My introduction. I am Dr. Bansal. I was serving as a major in the Remote Veterinary Corps in Indian Army. I am a equine specialist, basically. About 2 months back, while at Merit, I felt little haziness in my eye. Then I approached the head of the Department of Ophthalmology, Government Medical College, Merit, Dr. Mrs. Goyal. She mentioned after examining my eyes, she advised me that I have got a cataract in my left eye and it should be operated at the earliest possible. It was the month of the June. Now my wife is serving as a principal medical college Kota. That I mentioned to her, she says once you go to Kota, you get your operation performed at Kota in a month or 2 months time. I came to Kota during the month of August. On account of certain domestic unavoidable circumstances, it was not possible for me to get the operation done during the month of August. Since my son was proceeding to US, so we were moving to US Embassy and from post to pillar, getting his job done. My wife during the month of August only mentioned that in the Kota we will go to Dr. Suresh Pandey sir. He is probably one of the most competent person in Kota. Here I would like to mention, irrespective of being a principal of the Government Medical College Kota, I could have availed all the facilities in the Government Medical Hospital, that is MVS. But she preferred me to be operated by the most competent person in her views, that is Dr. Pandey sir. Keeping her advice in view, we both visited Dr. Pandey sir on 3rd September. He examined my eyes and found that the left eye was getting worsened on account of the cataract. It was probably, I was lucky that my right eye was compensating the default of the left eye, and we fixed the date on 5th of this September. On 5th of this September, I was examined by Dr. Pandey and then I was operated in his hospital. And my wife was there during the operation. Not only my operation, she witnessed the operation performed by Dr. Mrs. Pandey. I have to admire, I have to appreciate the professional competency of Dr. Pandey sir. Now today is probably third time I have visited him. After examining my eyes, Dr. Pandey feels satisfaction. My vision in my left eye is improving, and it will improve in due course of time. That is what I have been assured by Dr. Pandey sir. When I talk of this surgery, after surgery until today I have not put any gauze or I am not using any sort of bandage to cover my left eye. I am working, nobody can make me out that I have been operated. So the way he has performed surgery, not only surgeon, he is a good human being. Dr. Pandey as well as Mrs. Pandey, both are a very good human being too. I wish they progress very much in future. Many more feathers in their cap. That's what I can say. And I think if a patient gets back to his home with satisfaction, is a perfect. That's what only the patient requires. If he goes with satisfaction, he will tell 10 more person that look, SUVi hospital is one of the good hospital. On the contrary, if he doesn't get the required results, then he might not further mention to many people about this thing. So in this regard, I found Dr. Pandey is a very good surgeon. I have seen him operating today. The great coordination between microscope, between his eyes, seeing the various organs, and the coordination between eyes and hand, which were holding the equipments, is a wonderful, is amazing, appreciable. Once again, I wish him all the best. Along with Dr. Pandey, his staff, very well behaved. I found them very gentle. And getting back to the surgery, I've been put multifocal lens in my left eye. Today I was discussing with Dr. Pandey. Probably he operates roughly 20, there are about 20 cases in a month where they put multifocal lens. In my case, it was a Tecnis Multifocal implanted in my left eye. I am feeling better, I am improving day per day, and hope I will improve further. Retinopathy that affect people after the age of 50 years. Prevention is better than cure in such cases. Dr. Suresh Pandey, cataract. A cataract is a clouding of the lens within the eyes. The lens is composed of water and protein. If the protein clumps together, it starts to cloud over a small area of the lens. This cloudy mass of protein, called a cataract, can grow larger, making it hard to see. Cause, incidence and risk factor. The lens of the eye is normally clear. Until a person is around age 45, the shape of the lens is able to change. This allows the lens to focus on an object, whether it is close or far away. As we age, protein in the lens begins to break down and the lens becomes cloudy. What the eye sees may appear blurry. The condition is known as a cataract.